Good morning. My name is Riley. I'm going to be your nurse today. Can you tell me your name?
Tyrell.
Nice to meet you, Tyrell.
Nice to meet you, Riley.
I'm going to wash my hands for 20 seconds with soap and water. Provide privacy for the patient. And to begin our assessment, I'm just going to ask you some questions to determine your mental status. So can you tell me your full name and date of birth?
Tyrell Mouton, June 6, 1997.
Can you tell me where we're at?
We are in Nederland, Texas.
Can you tell me today's date with the month, day, and year?
Today's date is November 21st, 2025.
And can you tell me what we're doing here today?
We're doing the assessment.
Okay. He's awake, alert, oriented to person, place, time, and situation. I'll just get your vitals.
All right.
His temperature is good. It's 97.0. His pulse is 87. His oxygen saturation is 98. Your blood pressure was 112 over 68, and your respirations were 17. Okay, next we'll start the exam by inspecting his scalp. The scalp is clear, his hair is evenly distributed. Then we'll palpate for any tenderness, so just tell me if it hurts.
No, ma'am.
Okay. We'll look at his face, we'll see if it's symmetrical or not, which it is symmetrical. His skin is clear. He does have facial hair, but there's no abnormalities noted. The next, we'll look at his eyes, and we'll just check to make sure that his pupils are equal and round and reactive to light. So you can just look off into the distance, which they both react to light. And then we will check for accommodation, so you just look at my finger and then we'll follow it inward. Okay, and both pupils are accommodated. Just look up at me. We'll check his eyes to make sure that there's no abnormalities. So his sclera is white. We'll pull down on both lids and we'll check which they both are white. And the upper is white. And then we will palpate for any tenderness in the face. Can you just tell me if it hurts?
No, ma'am.
No. Okay. We will do a vision test. I'll just get you to read the last line.
Last line.
Yeah, do cover one eye first.
Okay.
And then just follow from that side to that side.
All right. Here we go. LTFPH.
Okay, now cover the other eye. And you can
LTFPH.
now uncover and see them. Yeah.
I like this too. LTFPH.
Okay. He has 20/20 vision.
20/20.
Next, we're gonna test the cranial nerve 7. So we'll have you smile with your teeth, and then we'll have you try to frown. Okay, and then you will blow out your cheeks like a pufferfish, and then you'll lightly close your eyes. You can stop blowing out your cheeks now, and then you can open your eyes and then raise your eyebrows. Okay, so the cranial nerve 7 is intact. Next, we will test the sensation of the face. So just lightly close your eyes and we will check. So just tell me if you feel sharp or dull.
A little sharp, I thought. that's sharp also. Same. That's a little soft. Hard. Soft.
Okay. He has sensation in his face. Next we're going to look at the nose and the mouth. So we check the eyes, we're gonna do the nose, mouth, and ears. So his nose, we're gonna check for patency. So I'm gonna include one nostril and you'll just breathe in and out. Okay, and then breathe in and out. Okay, his nose is patent, then we're gonna look on the inside. It's normal. He has no drainage or anything like that. Next, we're gonna check for smell. So I'm gonna just put something up against your nose and you just tell
Well,
me.
don't put that too close.
No, I'm not. Just smell. Actually, I gotta do one nostril at a time. So smell.
I smell it. Don't put too close.
Okay, can you tell me what you smell?
Cinnamon. Let it go off me, girl.
Alright. Can you smell it?
It's vanilla.
Okay, great. He can smell fine. You don't have no issues. Next, we're going to inspect the bowels. So you have to open your mouth, just regular. Look in there. The uvula is intact. And go The uvula is intact. His skin looks normal. A little press down on the tongue. And we'll look at the buccal areas of the mouth. His teeth look normal. His gums look normal. We would also palpate the tongue
Okay.
and check for a gag reflex. Do you have a gag reflex? Because we're not going to make you choke on camera.
Yeah.
Okay, so that's done. We'll do a taste sensation. A taste test.
Okay.
To test for your taste sensation. So you can do this however you want. You can just stick your tongue in it. Tell me what it.
What is that? It's bitter.
That's coffee.
Sugar. Sweet. Be careful. Tongue ain't that long. Salt. Lemon.
Okay. So after we did that, we've also, after we inspected the mouth and everything, to the soft, hard palates and all that, and the lips. And let me see, I'm gonna look at your tonsils. Open. Put your tongue flat. Oh. Okay. Alright. We tested for the tongue strength and all that. Next, we will look at the neck and the ears. So his neck is normal. We will palpate the mandible, which is normal. Then we'll palpate the post-auricular, pre-auricular. You don't have to do any of that. Tonsillar, and then the submandibular nose, and then the submental node. And then we'll palpate the trachea, and then just swallow for me. Okay, we'll palpate the thyroid, and if it's enlarged, then you listen for a brood. Then we'll palpate the carotids on each side. Don't do it at the same time, because otherwise you'll pass out.
Really?
Yep.
Oh wow.
And then we'll just
I'm gonna try that on
listen.
somebody.
Which is normal. Next we're gonna look at the ears. We'll pull up and back. We'll look inside the ear. tympanic membrane, which is pearly white, condylites present, and he has minimal earwax, which is normal. We'll look at the outside of the ear, which is normal. The lobule, the auricle, and the tragus, and palpate, which there's no tenderness or abnormalities or redness or anything like that. There's no drainage. No one look at this ear. We'll pull up and back. Check the tympanic membrane, which he has wax in there, which is normal. The tympanic membrane is intact, it's pearly white, and the condyle is present. We'll do the same with this ear. We'll palpate, which is no tenderness. We'll check the lobule, tragus, and the auricle, which is all normal. After that, we'll move down to the chest. So, you can just like lift your shirt upwards. We inspect the chest. It's normal. He has a small amount of hair distribution, which is normal for him. Then we will palpate. Any pain?
No, ma'am.
Tenderness? No tenderness. And then we will auscultate the lungs. Start up here. So just breathe in and out. In and out. In and out. And then we'll check your backside. You can just turn it a little bit. Okay, so his posterior chest is normal. He has a rash, which he's been treating with cream. And then we'll palpate for tenderness. Any tenderness?
No, ma'am.
Okay. And then we'll auscultate the lung sounds. And just breathe in and out. 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 Okay. After that, we will listen to your heart sounds. So come to the front. We will listen to your heart, which is you can hear the S1 and S2. You can hear S1 and S2 in all, I think it's 4 or 5 areas of the chest. Which is the aortic, the pulmonic, herbs, and tricuspid, and then the apex and the apical, we palpate. So we palpate right here, see if we feel it. Okay, and we'll have you lay on your left side.
Sideways?
And then you'll palpate it like that. But sometimes it's easier to. Okay. Alright, now you can lay straight on your back. And you can just raise your shirt up just a little bit where your abdomen. So we'll inspect the abdomen. It looks normal. Then we will auscultate. So it'll listen to bowel sounds in all 4 quadrants.
Right.
So we'll start with the right upper, which are normal, you can hear them. Then the left upper, the left lower, and the right lower. Normal. Then we'll percuss. And then next we'll just palpate. And we're feeling for the organs, if there's any enlarged organs, and if there's any pain or tenderness. Do you feel any pain or tenderness?
No.
Okay, that's fine. You can sit up now. After that, we're gonna inspect the upper extremities. So his arms, they're normal, bilateral. Let's see, got one, which is good. Then hold them out. So we'll check the brachial pulse in each arm. And we'll check the, I'll keep it like that. The radial and the ulnar. And then the radial and the ulnar. We'll test the sensation. So close your eyes. Tell me when you feel it, if you feel sharp or dull.
Sharp. Dual. Soft. Sharp. Soft. Sharp. Soft.
Alright, that's done. And then now we'll check range of motions and the hands. The wrist. The wrist. Okay, and then I don't think you know. Alright, so you'll grab mine. So that's testing for the strength, which is normal. Okay, you can let go.
Sorry. Focus.
I can't concentrate with you.
Alright.
Oh, so wrist, can you forward, backward, side to side? We're gonna test for capillary refills and then we'll look at your feet. So let me see your nails.
I can look at my feet.
Yeah, well, I'm gonna socks on too. Alright. Capillary refills are good, they're less than 3 seconds. Legs, put them out for me. Fine. Of course, I'm wearing gloves throughout this entire assessment. His capillary refills are good. He does have hair on his legs, which are normal because he's a man. We'll check for the popliteal pulses, which is in the back of the knees on each of the leg. Then I think it's the tibial pulses in the back of the feet. Then the dorsalis pedis on top. And the femoral pulse, which is in the groin area, but we're not going to do
Okay.
that.
Yeah.
Okay. So now I think I'm gonna have to get you to stand up. Actually, we're gonna test for sensations in the leg, and then we're gonna first do a shin, heel to shin. So put this heel up here,
What do you mean?
like your heel of your leg. No, like right here, and then you'll go down. Like that. But just do it by yourself.
Right now?
Yeah. And then do the other leg on the other heel on the other leg.
Yeah.
Alright. And now we're gonna test for sensation.
Alright.
So-
Close my eyes.
Mm-hmm.
That's sharp. You're turning me boogie. Soft. Hard. Soft. Soft. A little hard. Soft.
And he has sensation. Alright, so now we're gonna get you to stand up.
Alright. I need help. I'm just kidding.
Don't do that. Alright, just walk towards the camera a little bit and then turn around and walk the other way. Okay. So his gait is normal. Just stay standing. Now, I'm gonna get you to turn so I can look at your back. We gotta check for scoliosis.
I might have it.
No, it's midline. He ain't got nothing wrong with him. Turn around.
I have a mild case.
We're gonna test for strength in the upper extremities and lower extremities. So I'll get you to hold your arm out. Okay, try and go, no. So just hold them out and then you'll push up against my hands. Okay. And now you push down. Okay. Now hold them like this at a 90 degree. Actually put them back out. wanna go outward?
What?
Like push outward?
Oh,
Okay. And then push inward? Okay. So that's the strength for arms. Now we're gonna do elbows. So elbows, we'll do inner, push inner, okay, push outer, okay, push upper, okay, push downward. Alright, now we did your hand grasp, which those are normal, and the range of motion. For your wrist, so put your hands out. Alright, now I want you to, okay, alright, okay, and then outward, so no, like, you'll keep it like this, but you'll move it,
oh,
so, yep,
swervity toes.
okay.
You out my way.
So wrist, fingers, arms, so now you did all your arms. Now we gotta do your legs, so it's kind of the same thing.
And they stay standing.
So, yes, stay standing. So, you'll just put your legs straight out whenever I put it, so don't bend or anything, so straight, okay? I'll go backwards, okay? Alright. Alright. Now you'll bend your knee. So, I think it might be better to sit down and do that one. Okay, so you'll push against, and then you push against. Push against, and then push against. And then we'll do inward, outward,
Like I'm
inward,
dancing.
outward. Alright, stand up, because we gotta do your straight. Alright, push inward. I forgot to do the straight. Alright, outward. Inward. Outward. Alright.
Do it backwards.
Now you can sit down again. Take off your shoes.
Alright.
So we're gonna do your ankles. So you'll push upward with your ankle.
Don't hit me.
Up. With your ankle. Like
What that mean?
do like this.
Oh.
So you'll push up against it, and then downward, upward, downward, inward, outward, inward, outward. Alright, now I'm gonna check your reflexes on your knees.
Alright.
You ready?
I'm ready.
You'll have to kind of like dangle your feet a little bit. Like, yeah, scooch back. Okay. And I believe that completes our assessment for today.
Really?
Yes, sir. That's it. You're done.
Thank you, nurse, so much. I really felt safe in your arms
You
and
welcome.
hands
Mhm.
with every